Welcome to the show. When you hear the word caregiver, you might picture a nurse or a healthcare professional. But what about a son driving his mom to chemo, his wife or a wife managing her husband's medications, or a granddaughter helping her grandpa with groceries? These are the unsung heroes we're talking about today, family caregivers. They are all around us, and their role is one of the most important and least understood in our society. So, who are they really? Hi, my name is Jada Harris. I am the CEO and founder of Healthcare Advocates. We are a organization that provides consulting to corporations and individuals who are supporting family caregivers in the community. We hope that by joining this monthly podcast, that you're able to pull information to either help your employees or yourself as a family caregiver to support your family members. I have been a family caregiver for over 30 years, and it has been a blessing on this journey to help my family members who have had medical needs that range from a terminal illness to disease that they acquired. So, and I'll throughout the journey of each podcast, we'll have myself discussing various topics, including today's topics, who are family caregivers. And we'll also have guests that will provide us with their journey experience. So, first of all, we want to start with defining the family caregiver. It's more than what you think. A family caregiver is anyone who provides unpaid, ongoing assistance to a family member or friend with a chronic illness, disability, or other health condition. I provided health care or caregiving to my sons, one of which was from the time that he was born until he was 20 years old. My younger son, who is now 18, and my mother, who passed away of HIV/AIDS in 2008 after acquiring the disease and living with it for more than 10 years. It's not just hands-on care that you may think of. This is it's not only about tasks like bathing or feeding someone, it's also about emotional support, advocacy, financial management, scheduling appointments, and being the primary point of contact for doctors. When I provided caregiving services to my mother from 1997 through 2008, I didn't really think of myself as a family caregiver. I didn't even know what that title was. I just thought of myself as being a daughter who was helping my mom, who just found out at the time that she had acquired AIDS and that she at some point was not going to live, especially live the life that she intended. And so I shared the role or shared the duties with my four, well, there was four of us with my three siblings, my twin sister, my brother, who at the time was out of the state, and my younger brother who lived with my mother. I was at the time 23 years old, and I had three children of my own at that time. I was just finishing college. I had just started a career. And so it was a lot to take on in addition to being married, having my own medical uh, illnesses to deal with, such as diabetes. Um, I've just been diagnosed at that time. And so navigating all of those different roles and not understanding what resources were available or options were available, we kind of just was thrown into it. We were first informed by my mother, and then understanding that through medical experiences, a doctor's appointment, so on and so forth, over time, the responsibilities became more and more. Each one of us, of my siblings, even though my brother was out of the state at the time, he still provided support to my mother, emotional support. My younger brother cooked for my mother, and ran her small errands. I was responsible for picking up her medication because it was at the location where I worked at. So I took that responsibility, which over time became, you know, a good number of pill bottles, and costs for prescriptions, and understanding the medical system and the insurance and lack of insurance, and that role my sister took on. So we all just took on what we were strong at as family caregivers. The accidental role that I just mentioned, most people don't choose this role. They step into it out of love and necessity when a crisis hits. It often starts small, picking up prescriptions, and grows until it becomes a major part of life. It also is the responsibility of the next of kin of an individual with a health uh, condition, disability, or illness. The medical, as well as the authorities, place that responsibility on the next of kin. So there are some legalities that are people are responsible for if they don't help their family member with healthcare needs. A small snapshot of what the modern caregiver looks like includes about 53 million adults in the United States who are identified as caregivers. That's more than 1 in 5 people. Chances are you know several or you are one yourself. It's not just women. A lot of people think that majority of caregivers are women, and that's because of our uh, nurturing nature. We tend to step into the role automatically, but men are caregivers as well. They may assume the role differently. In my experience, so in addition to being a family caregiver, after my mother passed away in 2008, not long after that, in 2014, I was laid off from my employment uh, at a university, which I had had at that point for more than 10 years. And it was also during the time that I was still taking care of my older son and now my newer son, who both have sickle cell disease. And when I got laid off from that organization, and now in retrospect, probably because of all the stress that I endured from being a caregiver, as well as just living life, uh, I had to find new employment. And it just so happened that I worked or lived across the street from a rehabilitation hospital that was hiring nurses aides. And those are individuals who do the grunt work of nursing, and uh, they are able to provide the care within a controlled environment to patients with uh, with illnesses, short-term disabilities, or short-term care needs. And when that happened, I became a professional caregiver. So in that experience, I started working with families and in their homes and helping their family members with medical needs. And what I experienced was that men, they may have not been hands-on for their family members uh, that needed help, but they hired people like myself to provide the care that they didn't feel comfortable giving themselves. The reason why this podcast is entitled Decisions for Mom is because either it is majority of women who are providing caregiving to their family members, or it is women who are receiving the caregiving services. So typically the son is hiring someone to take care of their moms because women live longer than men. So either way, it's a decision for the mom who's within the sandwich generation, or it is the decision for the family member that needs care. In addition to gender, age comes into play as well. And it's not just individuals like myself who are Generation X who are taking care of baby boomers, but more and more we're seeing not just millennials, but also even younger children who are performing caregiving tasks, especially as uh, income becomes a factor in being able to afford caregiving services, caregiving resources. And so even children are taking on some of the role. Caregivers come from every race, ethnicity, and socioeconomic background. The experience, however, can different, be vastly different based on cultural norms and access to resources. In some countries, it's absolutely normal that the entire family lives in one home. And so caregiving is not as taxing on that culture. However, it still may be uh, more of a woman's role than a man's role when it comes to family caregiving in certain cultures. It also, in America, it is more likely that the family caregiving is contracted out or services and resources are acquired. But if the family cannot afford it, then the services are not as efficient as a family that can afford the services and or resources. A caregiver wears many hats, including the role of a medical assistant, which schedules medications, operating medical equipment that may be in the home, and monitoring symptoms that the patient may have. Let me put in your mind about in a example of a family caregiving journey. You have a woman who is in her 80s and she is still operating a vehicle and she ends up in an accident. Accident doesn't cause too much damage to the car, but during the accident, the woman was jolted, hit pretty hard. That caused, in a woman of that age, would cause more damage than a younger woman. And therefore, now the woman needs at least 48 hours of care.